Corey Earle has an intellectual disability and says the pandemic stripped him of his routine, his social circle, and his support.
Disabilities have been looked over beyond this pandemic. We certainly have been left behind.
The results of a large-scale study out of the UK last week show Earle may be right. It found adults living with intellectual disabilities face an increased risk of hospitalization or death due to COVID-19, 3 times that of the general population. People with Down syndrome or cerebral palsy were most in jeopardy because of pre-existing conditions including obesity, diabetes, epilepsy, and even poverty. Laura Lachance's 28-year-old son Kevin has Down syndrome.
It was a challenge to get him to increase his social distancing and to be very careful about hand sanitizing and to wear a mask in public places.
Lachance says since she was able to care for him at home, he wasn't isolated and was given an education on vaccination. But across the country, COVID-19 shot prioritization differs from province to province.
They may have been prioritized, but absolutely people are going to need help in getting access to it, whether that's online, whether that's physically getting there, etc.
Bioethicist Carrie Bowman says the pandemic has highlighted the marginalization of our community's most vulnerable and wants to see the government
develop systems of access to support, safety, as well as potentially vaccines.
People were not treated well at all in many, many cases during this pandemic. And, they weren't prioritized for personal protective equipment. Their workers weren't prioritized. There were all kinds of issues for people with disabilities across the country.
Experts we spoke with say, unlike in the UK, Canada's not currently tracking data when it comes to the mortality rate of intellectually disabled amid COVID. However, they have no reason to believe the statistics would be any different, adding without further financial and healthcare supports, more people are at risk. Jamie Mauracher, Global News, Toronto.